Hello, I'm Gustavo Tolosa, and we are in chapter 9 of the book Dr. McDougall's Medicine, a Challenging Second Opinion, and this is the last session. If you would like to watch the previous session, chapter 8, you can look in the description area of this video. Make sure you subscribe to my channel and click on the little bell for notifications. It really helps me to continue making these free videos and book clubs for you. And remember that in this YouTube channel there is a playlist that is called Online Book Club, and you can watch all previous book clubs. They're really amazing. They're really awesome. I hope that you will take a look. So today is the last session, and then we will be starting a new book club, and you can find the link in the description area for the month of February 2022. So let's go to chapter 9, and this is on page 255. If you don't have the electronic version of the book, send me an email. I'll send it to you, even though it's not free anymore on Dr. McDougall's website. I can send you the file. So what about urinary disease? Functional kidney tissues can be lost from a variety of diseases and injuries. For example, if a person suffers from severe shock after a serious accident or a heart attack, a sudden and long-lasting decrease in the flow of blood to the kidneys can cause some of their tissues to die. For some people, atherosclerosis can slowly narrow the large and small arteries that supply the kidneys and lead to kidney failure. Atherosclerosis is accelerated by high cholesterol levels, high blood pressure, and diabetes. In addition, both high blood pressure and diabetes have their own ways of damaging the kidneys and are notorious for causing rapid deterioration of kidney function. Chemical poisoning can destroy kidney tissues as well. On page 256, the question is there anything I can do to avoid taking all those antibiotics from occasional bladder infections? Dr. McDougall says most likely your bladder problems are not related to your kidneys. Very interesting, because people may think that they are related. Dr. McDougall says most likely they're not related, even though in some people bladder infections do extend to become kidney infections. Infections of the bladder are common in women and are often associated with injury to the outlet tube of the bladder, which is called the urethra. And I find this interesting, how women are more prompt to getting these infections than men. Not that men can't or don't. For many women, the burning of the urethra on urination is caused by the soap they use in washing. Women with recurrent episodes of painful urination, especially in cases when no harmful bacteria can be grown in laboratory tests, are very likely to find a cure to their distress in simply avoiding all types of soaps and using only tap water in cleaning the area, the vaginal area. Doctors recognize that a natural agent for treating minor bladder infections is cranberry juice. You may have heard of this, and it's actually something that doctors know that works, and many times will recommend that you drink. And of course, this is for minor bladder infections. Cranberry juice. The body converts some of this juice into an organic acid. Concentrated in the urine, this causes the bladder contents to become acidic. And of course, most of the harmful bacteria cannot survive in this acid environment, and the infection subsides. To achieve adequate concentrations of the inhibiting acid, you should drink a whole quart of cranberry juice all at one time. And this is important. Dr. McDougall is saying, don't break it up during the day. You've got to bathe the tissue in this acidic liquid, basically. And you've got to drink a whole quart all at once. Well, take it, maybe wait a few seconds, drink more, but don't break it in 4 or 5 or 6 times a day. The ordinary treatment of bladder infections with antibiotics calls for a 10-day course of pills taken 4 times a day. Although that's an older way, there is a new way way now in the present time that you take a single dose of an antibiotic. Results are as good. The patient's compliance is more easily gained when it's 1 time a day instead of 4, and side effects are less. If in the future you get another bladder infection that requires treatment with antibiotics, ask your doctor about this once a day pill. And on page 259, Dr. McDougall says that once chronic kidney failure has begun, the course of events is all but decreed. A steady decline in function at a constant rate, allowing an accurate prediction of the date when end-stage kidney failure will be reached, and the patient will need the help of a kidney machine in order to survive. So hopefully you won't allow it to get to the point where you get to that stage. Because the disease is progressive and at present is untreatable by surgery or drugs, the opportunity should not be overlooked to help the patient by recommending a change in diet. It really cannot hurt. Dr. McDougall says studies have not yet been done to establish the exact role of foods in the cause and possible treatment of chronic glomerulonephritis. However, it is important that the investigations be performed soon, etc. The elimination of all dairy products will likely give the greatest results for people with antigen antibody complex diseases. So it's crucial that, number one, you stop eating all dairy products. But there are many other foods that are involved in allergic diseases that can affect the kidneys, such as eggs. Well, I usually put eggs under dairy, but perhaps it's not there. Meat, wheat, and corn. So at the end of this book, you have the elimination diet, which should be used to search out trouble-making food. This way of eating will help you to tell which kinds of food are the ones that are causing the trouble. The greatest help from a dietary change is gained when the total protein content of meat is reduced. Not only are the waste products from protein, such as urea, reduced in amount, but in most cases the progression of the underlying disease can be halted or slowed, especially when the change is begun early in the course of disease. So besides dairy, if you stop eating meat and animal protein, the disease can be halted or slowed. People with kidney disease, Dr. McDougall says, usually lose protein as a result of leakage through their damaged kidneys into the urine. Because of this loss, some doctors and dietitians mistakenly recommend a high protein diet, assuming that the extra protein will compensate for the amounts lost. But here is the issue. Okay, Dr. McDougall says, but this added protein is not needed. All natural diets, whether based on vegetables or on animal products, provide more than enough proteins to meet our needs in times of health or disease. Adding more proteins in the diet won't make the metabolic system work any better. Replacement of lost proteins is not accomplished by this effort. In fact, the excessive amounts of proteins actually will worsen the kidney disease. The way to stop the loss of proteins into the urine is to stop the injury to the glomeruli. I don't know exactly how to pronounce it, but it is spelled Glomeruli. Among the most subtle and important toxins you can force upon your kidneys are the excessive amounts of proteins that are eaten daily by the average American. Again, we come back to protein. Excess proteins, we're not talking regular amounts of protein, we're talking how the American, the standard American diet, but now most of the diets in the world have excessive amounts of protein. So Dr. McDougall says excess proteins are not stored in the body in the way that excess calories are stored as a body fat. When you have too many calories, those calories are stored as body fat. Excess proteins have to be eliminated. They're not stored. The byproduct of proteins that are not used for body repair and growth spill over into the bloodstream and remain there until they're removed by the liver and kidneys. So this is where it becomes dangerous when you eat too much protein, especially animal protein. Once the body uses what's needed and not much is needed, those proteins spill over into the bloodstream and they stay there until what? Until the liver and the kidneys remove the protein. The parts of the kidneys that filter them out of the bloodstream are called nephrons. Destruction of the nephrons is believed to be caused directly by the remnants of the excess protein. If there is anything you can get out of this, I think this is one of the biggest teachings. The timely introduction of a low protein diet, like the one that Dr. McDougall recommends, which is called the starch solution. By the way, I am a certified starch solution coach by the Health Medical Center of Dr. McDougall. If you ever need a coach for half an hour, I am available. Send me an email. But the timely introduction of a low-protein diet can keep someone with progressive kidney disease like yourself off the kidney machine for a longer time, if not forever. Many reports have appeared in the medical literature indicating the remarkable benefits that restricting protein intake achieves in slowing or even halting the progress of kidney failure. And then Dr. McDougall continues to describe a recent study of 228 kidney patients. On page 262, Dr. McDougall says many patients are never given this information at all. And this is always what angers me, upsets me, it saddens me as well that patients are not given the information. Patients should be given the information and should have a say in how they want to be treated. If they want to take drugs or be hooked to a kidney machine, that's fine, but it is their choice. As a direct result, their conditions steadily worsen and their future prospects are bleak, to say the least. Dr. McDougall says that high levels of blood calcium, along with the high levels of phosphates, are believed to worsen kidney failure, possibly by forming calcium deposits in the kidney tissues. You may notice the similarity between high phosphate and high protein foods as being animal products and expect that you would gain benefits from restricting the intake of both kinds of ingredients. However, of all the components of the foods we eat that are found to be harmful to the kidneys, available evidence indicates that the primary benefits from a dietary change come from lowering the protein content. Protein, and protein. Decrease it, eliminate it. So, question, is there anything that can be done for my swollen feet? My blood pressure has recently gone up. Could a low salt diet help both these problems? And the answer that Dr. McDougall gives is yes. You should cut down on your salt intake. Salt is eliminated by the kidneys. If the capacity of the kidneys is decreased to the point where more salt is taken in that can be eliminated, then this mineral compound will accumulate in the body and water is retained in proportion to the amount of salt accumulated, and the body's tissues then swell. The kidneys are important regulators of blood pressure. Did you know that? And when they are damaged, the blood pressure frequently rises, sometimes to a very high level. The restriction of salt, animal fats, and proteins can be very beneficial in lowering the blood pressure through a variety of mechanisms. These strategies can reduce or eliminate the need for medication used to treat high blood pressure. On page 265, Dr. McDougall says at the bottom of the page, the two most common types of stones seen in the United States, called calcium stones and uric acid stones, are named for the dominant mineral ingredient in each kind. So someone says, what causes the calcium type stones? Calcium stones are found mostly in developed countries where people can afford to eat the rich, expensive foods. And many times a week, 3 times a day, 21 times a week. The dietary factor that is most strongly related to the formation of kidney stones is animal proteins. Again, after World War I and II, when food became more abundant again, near epidemics of stones occurred in many countries in Europe. The effect of proteins on the body, especially animal proteins, increases the excretion of calcium through the kidneys into the urine. The calcium comes from the foods eaten and from the stores of its depository found in the bones. The urine carries calcium in high concentration. As the urine becomes saturated with calcium and other minerals, microscopic crystals form, and around these core crystal stones will grow to a visible and very troublesome size. Eating meats also increases the amount of oxalate in the urine. Oxalate is the second mineral component in the most common form of kidney stone in this country, in the United States. On page 268, the question is, can kidney stones be dissolved with a good diet? Uric acid stones can be dissolved by making the urine more alkaline. This is accomplished by decreasing the intake of animal protein, increasing the amount of potassium contributed by vegetable foods, and drinking more water. A medication called allopurinol is recommended in addition to potassium salts. In one small study, this approach was 100% effective. For now, however, in most patients, painful kidney stones are removed by surgical procedures. If I have to limit my intake of proteins, this person says, cholesterol and salt, and later potassium, what is left for me to eat? Your diet, Dr. McDougall says, for now, should be centered around a variety of starchy foods such as potatoes, sweet potatoes, corn, rice, and other whole grains. To this central starch staple, you should add fruits and vegetables low in proteins. Foods from the legume family, underline this, foods from the legume family such as beans, peas, and lentils are high in proteins and should be eliminated or limited. This is if you're having kidney disease. Otherwise, plant sources of protein should be okay. But Dr. McDougall still recommends about a cup a day. There are so many other starches available that it shouldn't be a problem to limit. Most of the information I've shared with you, Dr. McDougall says, was reported 40 years ago to physicians in meetings and medical journals. This all started at the beginning of the year 1946 with a very respected Dr. Walter Kempner of Duke University. And he already talked about this issue of protein. Okay. Why, since this information has been available for so many years, Why are patients still not given this information? It's, I guess we could all guess that there are many other interests, and they're not really the patient's interests. And yet, few patients today are offered the advantages of a simple, safe, and inexpensive therapy. So Dr. McDougall says, is a change in diet simply too much for a doctor to suggest to a patient? Perhaps more of us in the health professions should give our patients a chance to answer this question and to choose this highly effective therapy. I think that was a great way to end this chapter. Is a change in diet simply too much for a doctor to suggest to a patient? Perhaps more of us in the health professions should give our patients a chance to answer this question and to choose this highly effective therapy. Well, thank you very much for joining me for another online book club in the month of January 2022. I hope you will register and sign up for the free online club that comes in February. We will be reading another really good book. It's called Food is Climate by Glenn Mercer. You can find the link in this description of this video and register, and I hope that I'll see you then. Goodbye everybody, and have a wonderful week.